Okay, good morning, class. We are here once again to study pharmacology. In our last video, we ended with the route of drug administration. We look at the various routes of drug administration. So, with today's lectures, we are going to start pharmacokinetics. One may ask, what is pharmacokinetics? Pharmacokinetics simply means movement of drug from one part of the body to the other. When we administer drug moves from one compartment of the body to the other. So that is pharmacokinetic. It is defined as movement of drug inside the body, beginning from the onset of action, tied to the peak effects and duration of action. So how drug move from one compartment of the body to the other. In order for a drug to bring about an effect, a drug molecule must first travel from site of administration to the site of action. So the drug molecule must move from where you administered it to the target site. So when you swallow a drug, the drug doesn't end in your stomach. It leaves your stomach to your small intestine, and then from your small intestine by the portal circulation to the systemic circulation. So that is pharmacokinetics. There are four processes involved in pharmacokinetics. So these pharmacokinetics, we have four processes: absorption, distribution, metabolism, and excretion. So absorption, absorption. So all four phases of pharmacokinetics are what absorption, distribution, metabolism, and excretion. And as I said, they all involve what drug movement. So drug must first cross membrane to the blood from the site of action. So this means that uh, once you administer the drug will have to move from the site of administration. Then, when the drug also gets into the bloodstream, the drug must still leave the vascular system to their site of action. And from the site of action, the drug will also cross membrane to undergo metabolism and finally what excretion. So these are the four phases of pharmacokinetics. So we are going to look at it one after the other. So pharmacokinetics, as I said, there are what four processes involved. We are going to look at all those four processes: absorption, distribution, metabolism, and what excretion. So we are going to look at these four processes in details. So if you look at the diagram on the screen from the dosage to the plasma. So when you take a drug, the drug will end in the plasma. So pharmacokinetics. So let's say absorption will bring the drug to the plasma. Then when we get to the pharmacodynamics, we're going to talk about that. That one has to deal with mechanism of drug action, how drug really works. So but now we're going to focus on pharmacokinetics. Drug absorption. What is absorption? Absorption is the passage of drugs from the site of administration to a site of action through cell membrane. But other books will say absorption is the movement of drug from the site of action toward systemic circulation. So the main idea is to get the blood into the systemic circulation. Once the drug gets into the systemic circulation, it is then distributed to the site of what action. So absorption is the passage or movement of drugs from the site of administration to the bloodstream, so to the systemic circulation. So that is what absorption is. So passage of drug across membranes. So before a drug can be absorbed, before a drug can really get into the bloodstream or can really get into the, let's say, the bloodstream, for it to get to the site of action, the drug must first cross membranes. So several membranes will have to be penetrated. We have a lot of membranes. So you swallow the drug will have to penetrate through the stomach layers, get to the small intestine. That also penetrate to the small intestine through the portal circulation, then to the system. So in all this, the drug will have to be moving from one compartment of the body to the other. So as I said, they all involve what drug movement. So we are going to look at factors that determine the passage of drug across biological memory. What are some of the things or factors that affect how drug passes through cell memory? So we are going. The first thing that we are going to look at is the membrane structure. how our membrane or our cell membranes are structured. We all know that our cell membrane is made up of a phospholipid bilayer. So the cell membrane is made up of what? A phospholipid bilayer. This means that we have our membrane is more of what? Lipid. So because the membrane is lipid, for substances to be able to go through this membrane, the substance will have to be lipid soluble. So cell membrane consists of a lipid bilayer with interspersed protein. So the cell membrane consists of a lipid bilayer, and within this lipid bilayer, we have proteins embedded in them. The lipid bilayers are mostly tight junctions. So because of this, only soluble substances can diffuse. This means that substances that are lipid soluble, they are the substances that can readily diffuse across the cell membrane. Water soluble substances can't pass through the tight layer. So with the cell membrane, only lipid soluble substances can readily pass through the cell membrane. When you look at this diagram, when you look at this diagram on the board, our cell membrane, we have something we call that the cell membrane is selective permeable. This means that the cell membrane allows certain substances to enter and also prevents certain substances from not entering. So the cell membrane is a lipid bilayer or is a semi-permeable. The structure of the cell membrane is such a way that not just any substances can readily diffuse or pass through it. So only certain substances can like pass through it. So we say it's what lipid or semi-permeable. This means that they control what comes in and what out. And substances that can't readily go through the cell membrane, they are substances that are large. So when the molecular size or the compound has a very large size, it can't readily diffuse through the cell membrane. Example of a compound like that is glucose. Or even though we eat the end product is glucose, glucose can't diffuse through the cell membrane. And because of that, glucose will need a specialized transport system to take it through. So large molecules or compound can't diffuse through cell membrane. And we have charge. Charge means any compound that carries this is a charge, so maybe Ca2 plus or Cl minus. So when a compound is carrying either a positive or a negative charge on it, they can't readily diffuse through cell membrane. And we have polar substances. Polar means water soluble, but our cell membrane is lipid soluble. So for substances to be able to go through this cell membrane, then that substance will have to be what? Lipid soluble. So polar substances can diffuse through cell membrane. Charged substances can diffuse through cell membrane. Then large molecules or substances can diffuse through cell membrane. So this means that the opposite is true. Non-polar. Non-polar means, let's say non-polar is not water soluble, so they are lipid soluble. So non-polar substances can diffuse through. Uncharged substances can also diffuse through. Then compound with a smaller size can readily diffuse through the cell membrane. So we are so just look at the diagram on the screen at the moment. So we have gases. So gases can really diffuse through a cell membrane. Then when you look at glucose the size is too big, so they can't. And when you look at what we have, the charged molecules, we have H plus, Cl minus, Ca2 plus. They are ions with charge. They carry charges. So because of the charge that they have, it becomes so difficult for them to penetrate through the cell membrane. So these are some of the things that makes it so difficult for substances to pass through. So a recap of what we've done. Polar substances can diffuse through the cell membrane. Charged substances can diffuse through the cell membrane. And molecules with a larger size can also diffuse through the cell membrane. Drug transport pathways. So now we are looking at some of the pathways at which drugs that we take use in making sure they get to where they are supposed to end. So there are three most important pathways by which drugs cross cell membrane. So there we have three most important pathways. One is the drug will either pass through a protein channels. Let's go back to the diagram of the cell membrane. When you look at the diagram of the cell membrane, you have You can see there are certain things embedded in those. So those are proteins. Some serve as a channel, some serve as a receptors, and some serve as so many things. So over here, we are saying that we are trying to say that drug can pass through, or we have three most important ways in which drug crosses the cell membrane. And one is they can either go through protein channels. So we have protein channels, they are pathways. And so you take a drug, and depending on the size of the drug, a specific protein channel can accommodate that drug. So drug can go through cell wall by what a protein channel. Then drugs too can also go through a cell wall with the aid of what a transport system. So we have some transport system. The proteins that are embedded in the cell membrane, some also serve as a transport system. So drug can use this transport system. So this transport system, drug that can't diffuse to the cell membrane by themselves because of their size and order, they can't go to the cell membrane by themselves. They will need some form of a help, and that help is what a transport system. So we have so many transport systems in our body that the drug sometimes uses in making sure that they cross the cell membrane. And a drug too can penetrate through the cell membrane by themselves. So by direct penetration, the drug penetrates through the cell membrane by themselves. And of all the three pathways that we have mentioned, penetration of the cell membrane is the most common. This means that most drugs diffuse through the cell membrane, or they can penetrate by themselves. They don't need a protein channel, or they don't need what a transport system. They go through the cell membranes by themselves. So we are going to take it one after the other, then you'll see what it entails. So passage through protein channels. Very few drugs crosses membrane via protein channel. This means that we have a very few drugs that can cross membrane via protein channel. Only the smallest compound can pass through this channel. So this means that for a drug molecule to be able to pass through this channel, then the molecule should be of a smallest size. If the molecule is big, then it means it can't go through what a protein channel, and probably they might need some form of a transport system to enable them what cross the cell membrane. Compound with the ability to cross cell membrane via protein channels are small ions such as potassium and sodium. So this means that ions or molecules with the smallest size can go through what the protein channels. Then we have the transport system. The transport system. Transport system are carriers that can move drug from one side of the cell membrane to the other. As I said, transport. Also like a car. The car will, let's say I want to travel to maybe Kumasi. So I will need a car. So the car will move me from Accra to where Kumasi. So we have a transport system. I can't go to Kumasi by I can't walk. I'll be tired. So I will need a specialized transport system to carry me to where Kumasi. So this means that a drug that can diffuse to the cell membrane by themselves, or a drug that can go through protein channels, they need a specialized transport system to enable them get to the path that they are going. All transport systems are selective. This means that the transport system picks a specific what agent or drug. They will not just carry any drug, and a number of drugs too could not reach like the site of action without what a transport system. So we have this transport system we are going to look at. So we have what we call carrier-mediated transport. Many cell membrane possesses what? Or yes. So most of the cell membranes, as I said, they have a specialized transport mechanism that regulate the entry and exit of what physiologically important molecules. So the cell membrane, as we saw, they have these proteins in them, and some of the proteins, as I said, some serve as a channel and some serve as a transport system. So, for example, glucose. For glucose to be able to enter into the cells for the cells to use, glucose need a specialized transport system we call the GLUT4 transport. GLUT4, G-L-U-T-H, GLUT4 transport system. Some books spell it G-L-U-T. So GLUT4 transport system. So this there are special transport systems that help glucose to leave the bloodstream and enter into where the tissues. So glucose are supposed to be in the tissue. So when you have excess glucose within your plasma, then or your bloodstream, let me use that word, then you say that you have hyperglycemia because the glucose are supposed to enter into the cells for the cells to use. So why are you having a lot of glucose